are you Susan?
Yes.
Hi Susan, my name is Dr. Hudson. I am the Chief Medical Director here at San Joaquin Valley College Medical School. And I hear that you're having some troubles today. What brought you in?
Feel short of breath.
A little short of breath, I see. You're leaned over a little bit, working a little bit hard to get some air, huh?
Yeah.
Okay, well can you tell me a little bit about your shortness of breath? Does it happen when you're doing exercises or just a little bit of all the time?
More of all the time.
Okay, all right. Well, tell me a little bit about your history. Do you have a current smoking history?
Yes.
Yeah?
I've smoked for 35 years.
35 years, okay. All right, and how often do you smoke a day?
Pack and a half.
Okay. All right. Is there anything else that I should know about? Any prior surgeries or medical history?
No.
No? Okay. Pretty healthy otherwise? All right. Well, I'm going to just take a listen to your lungs really quick. I'm going to do a real basic assessment on you. I'm going to take your pulse and your oxygen saturation. I just need to put this on your finger. And while that's going, I'm going to give a listen to your lungs, okay?
Mm-hmm. Sure.
Okay, I'm just going to do a couple other little tests really quick to see if I can find out what's going on. What I'm going to do is first I'm going to listen to your lungs again and I'm going to have you say the word 99. And I'm going to have you repeat that a couple times. And basically what that's going to help me do is to help hear how the air is moving in your lungs, okay? And then the other thing that I'm going to do is I'm going to do what's called percussion. And what I'm going to do is I'm just going to place my fingers on your back and I'm going to tap like that. And it's kind of like what you do with a watermelon, and I'm going to see how the air sounds within your lungs, okay?
Sure.
All right. All right, and say 99.
99.
And one more time.
99.
One more time.
99.
And the last time.
99.
Okay. All right, now I'm going to do the percussions, okay?
Mm-hmm.
I'm done with all my tests for right now. I'm going to go ahead and order some more tests, and then while I'm doing that, I'm going to have you fill out a questionnaire for me, and it's going to tell me a little bit more about your shortness of breath. So go ahead and I'll have you fill this out, and I'll be right back, okay?
Sounds good.
All right. All right, Susan, you all done filling out the questionnaire?
Yes, I am.
Okay, great. I went ahead and scheduled an appointment for you to have some tests done with one of our respiratory therapists. So we'll be able to do that today and get that taken care of and hopefully fix whatever's going on with you, okay?
Okay.
All right, thank you so much, Susan. We'll see you in a little bit, okay?
Sounds good. See
All
you
right.
later.
Okay.
Bye.
Morning, Jamie. How you doing?
Good, how are you, Dr. Hudson?
Hey, I'm great. I've got a patient by the name of Susan. She came in to me this morning. She had a really bad short of breath, and she was tripoding and pursed lip breathing and showing some classic signs of COPD, some emphysema. Mm-hmm. So I wanted to have you do some pulmonary function tests so that we could confirm that she does have emphysema and also to determine the severity of her COPD.
Okay, I can do that for you.
Okay, I have her scheduled for today. It's going to be here in just a little bit. I've got her sitting in the waiting room right now. As soon as you get up, can get set up, can you see her?
Yeah, I should be ready in about 20 minutes or so.
Okay.
Were you planning on ordering a chest x-ray for her as well?
Yes, absolutely. I'll get the x-ray going. I'll plan that for after she's done with her pulmonary function testing. We'll get that and see what we see.
Okay, would you like me to take a blood gas as well?
Yes, that would be great.
Okay, perfect. Go ahead and write those orders and
Okay.
I will take her in about 20 minutes.
All right, fantastic. Thank you, Jamie.
Thanks, Dr.
See you later.
Hudson. ordered a pulmonary function test on you today, and I'm going to be doing that. So we need to go to another room. So if you want to follow me.
Okay.
This way. Okay, Susan, can you tell me how old you are?
I'm 85 years old.
Okay. And about how tall would you say you are?
5'4".
5'4"? And how much do you weigh?
115.
Okay. So what we're going to do is we're going to have you hold this, and you're going to put it in your mouth, and you're going to plug your nose.
Okay.
And when I tell you, you're going to take a really, really deep breath in as much as you can, and you're going to blow it out as hard and as fast as you can. And you're going to just keep blowing and blowing and blowing and blowing until I tell you to stop. And then you're going to take a really deep breath back in, okay? Do you understand? Okay, perfect. Why don't you go ahead and put that in your mouth and plug your nose. All right, we're going to start it. Take a deep breath in. And blow hard, 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 hard. Keep going, keep going, keep going. You got it. Keep going, keep going, keep going. And a deep breath in. Perfect. You know, you look a little bit winded, so I think this will be enough for Dr. Hudson to look at, okay? And then he also wanted me to do a blood draw for him. Are you going to be okay with that right now, or do you need a minute?
Yeah, I'm fine.
Okay.
Scared of needles. Gonna be okay.
Good job. All done. We'll send this off to the lab and give it to the doctor, and he can read it, okay?
Alrighty. Sounds good.
Perfect.
Sounds like a plan.
Okay, Susan, we're all done. Dr. Hudson will be in contact with you in a couple of days with the results, okay? Do you need help with finding your way out?
I think I'm fine.
Okay, perfect. It was nice to meet
Alright,
you.
have a good day.
You too.
Thank you.
Do you ever find that you're out of breath and have tightness in your chest? Does it ever feel like you have an elephant sitting on your chest? Well, if so, you may be like me and be experiencing symptoms of COPD and emphysema. But good news is there's a medication that will help alleviate those symptoms of tight chest and shortness of breath. My once-a-day Spiriva HandiHealer has alleviated the symptoms of tight chest and shortness of breath. Now keep in mind that Spiriva is not a rescue inhaler, so if you are in an emergency, do not take Spiriva, as it will not relieve the symptoms of an acute exacerbation. Spiriva helps you breathe.
Oh, I'm not feeling good.
Okay, excuse me, ma'am, you okay? Are you okay?
Hi, Susan. Remember me? I'm Jaimie. I'm a respiratory therapist. I'm here to give you a breathing treatment to help you out because it looks like you're having a hard time. The doctor should be in shortly, so we'll do his assessment on you. Let's go ahead and take this off. Okay, so what you're going to do is you're going to put your mouth on the end and just breathe in and out of it. Do you think you can hold this? Okay, perfect. I'll go let the doctor know that you're ready. Just going to listen to your lungs really quick and make sure that your heart rate's okay. finger. All right. Dr. Hudson should be in soon.
Hey Susan, it's Dr. Hudson. I didn't think we would see you so soon. What are you doing back?
I was smoking a cigarette and I just collapsed.
Did
That
you?
was it, yeah.
Okay.
It was awful.
Well, it looks like you've had a little bit of an exacerbation. You're done with your treatment, so I'll go ahead and take that for you. Me and Jaimie have been looking over all of your tests and everything, and unfortunately we do have some bad news. You are showing some classic signs of COPD, some emphysema.
What's that? Oh my gosh.
Yeah,
That
it
sounds
can be
serious.
quite serious. We contribute this to the long history of smoking, and I'm going to show you some stuff from your tests. First of all, I'm going to show you your X-rays. Now, what this is showing here is that there is an increased amount of airspace in your lungs. So it's what we call hyperinflation, and this happens from the smoking. It causes the alveoli, the little air sacs in your lungs, to stop working as well. They don't expand and retract as well as they used to. So after years and years of smoking, it can cause this to happen. So as we can see here, we have a lot of open space here, and then we can also see in this one here, we have a very large front to back airspace as well. This is what we call a large AP diameter, and so this is very common with patients with emphysema. Some other things that we had, Jaimie had the results of your pulmonary function testing, and I brought this just to compare for you. This is what a normal PFT curve would look like. We'd have a good inspiratory rise, and expiratory, and then an inhalation here. And unfortunately what we saw with yours, this is what you should have been like, but this is what we got. You were able to get the air in, but weren't quite able to get that breath out. And this can cause a lot of serious problems and can be the reason why you did have that episode outside when you went to have a cigarette. And Jaimie, what were some of the readings that you found from her ABG?
Oh, her ABG indicates that she has chronic alveolar hyperventilation.
Okay.
She's very, very high in CO2, very low in PO2, about 60-60.
Okay.
And she's compensating, so her pH is normal. I mean, she does have a little bit of her ABG results from what we just took right now show her to be a little acidotic.
Okay.
An acute exacerbation is what it indicates.
Okay.
Of her emphysema.
Okay.
So.
All right. Well, what I'm going to do is I'm going to suggest a couple things for you. Number one, you've got to stop the smoking. Here at the hospital, we do have a smoking cessation program, which can help you quit smoking. Is that something that you want to do?
Yeah, I'm gonna try to quit.
You think it's about time?
Yes, it's about time.
All right. So we're going to do that. We're going to set that up for you. What we're also going to do is I'm going to set you to go to pulmonary rehab as well. And pulmonary rehab, you're going to be able to go to the clinic, and basically what they're going to do is they're going to keep track of all of your statistics of how well you're breathing, kind of exercise you a little bit, and to help you maintain a good living now that you do have emphysema. So we want to make sure that you're keeping your airways good so that you don't have any more of these exacerbations. What I'm also going to do is I'm going to prescribe a couple medications for you. We're going to start giving you these right away because they'll help build up a tolerance in your body. It'll take a little bit. I'll show you this one here. This one is called Spiriva. This is going to be just a once-a-day medication. It's really simple and easy to do. I'll show you how to do it here really quick. What you'll do is there's a little pill that you put here inside, and then you close up this top part. You click it to puncture the pill, and then you just put your lips on it and breathe in. Do a nice good breath, go. And then hold your breath for 5 seconds and then exhale. So you'll be doing that once a day, and we'll also be giving you another one too. It's going to be called Advair. and that's just going to help. They're both going to be a maintenance drug. It's going to help maintain your airways, keep them nice and open, so you don't have any more attacks like this. I'm also going to give you a rescue inhaler as well. This will be for the extreme situations, if you're really feeling short out of breath, that you'll be able to take that right away and hopefully alleviate some of those symptoms, okay?
Okay.
All right, Susan, well, I'm sorry to bring all that bad news to you, but the good news is that people do go on living normal lives with COPD and emphysema. So we're going to do all that we can to make you as comfortable as possible and to live the same life that you have been living, okay?
Okay.
All right. Well, get better, Susan, and I'll be back to check with you later, okay?
Okay, doctor.
All right.
Thank you.
Thank you.
Okay, Susan, I'm just going to get some information together and let you know where you can go for your pulmonary rehab, and I'll set you up on a medication plan to help you with quitting smoking, either Nicorette or a patch, whichever you prefer. We can even do a lozenge, whatever you think would work best for you. It's really important that you quit smoking because we can stop the damage that has been done to your lungs so far, and with pulmonary rehab, we'll be able to give your lungs a little bit more strength so that you can lead, like the doctor was saying, a relatively good life, okay?
Okay.
Okay, I'll be back in a little bit.
Okay.
Okay, Susan, so here's some information on smoking cessation, and also attached to this is a place where you can go for pulmonary rehab. We've already called them and talked to them about your situation. They're going to be expecting you. This is your medication. This is a rescue inhaler. I'm sure you've seen these before. Lots of people carry these. The way this works is you're just going to shake it, attach it to the back. You're just going to shake it a couple times, put your mouth on it, actuate it by clicking it down. Take a deep breath. Nice, slow, deep breath. You don't want to hear a harmonica sound. And then hold your breath for about 5 seconds and let it out. And then you're going to do one more the same exact way.
Okay.
And this is only in the event that you have shortness of breath like you did when it brought you into the hospital, because this will help hold you over in case you need to come to the hospital. Help give you a little bit of relief, okay?
All right.
So that's for you. Do you want to show me how you do that? Do you remember?
Yeah, let's give it a try. Okay, so
Perfect. I wish all my patients were. And then you'll do one more, but you don't need to do another one right now.
okay. Sounds good.
Okay?
Hey, Susan, it's Dr. Hudson again. I see that Jaimie was showing you how to do your inhaler. It looks like you were doing a really good job on that. So we hope that your progress is going to be really good, and you're going to be doing really good once we send you home. I just wanted to let you know that when we do send you home, we're going to be putting you on home oxygen. What they're going to do is they're going to deliver some little tanks like we had back here when we were giving your treatment. And then they're also going to set up a oxygen concentrator so that you'll be able to be around the house, and if you're doing the dishes or cleaning the house or whatever you're doing, you'll be able to be on the oxygen. So you'll have a nice long cord that you'll be able to walk around everywhere that you need to go inside of the house. We're also going to set you up with a portable oxygen concentrator, so that if you need to go out to the store or you're going to go visit somebody, that you'll have that with you as well, and you won't be without your oxygen, okay?
All right.
Do you have any questions for me?
No, I'm good. Thank you.
All right, Susan. Well, we hope everything goes good for you, and we'll be checking up on you later on, okay?
Okay.
All right, thank you, Susan.
All right, Susan. Well, you can go ahead and get ready to go. While you're getting ready, I'll get your oxygen set up for you and explain to you how it works. And then we'll send you on your way, okay?
Okay.
All right.
Thank you.
You're welcome. And well, it looks like you're all set up, and we'll get you on your way, and the doctor will be in touch with you again to see how you're doing, okay?
Okay.
All right, let's go.